Okay, members, we're now going to turn to item R1, 22, and 73, Sharps, and we have a presentation by staff.
Yes, Madam Chair. Dr. Jeffrey Gusenhauser, Interim Health Officer, and Angelo Belomo are here to make a presentation.
Okay, great, thank you. Thanks a lot. That's forward, that's back. The machine, so I have to point that way. Okay. Where's Kobe? Right here. Hey, Kobe. You see that? Kobe, you see that machine over there? That computer? Did you advance this? Because I don't know this.
Yes.
And you'll know when I have to.
You got it. Okay. So much.
Ready for y'all?
Thank you.
Okay,
Want to go ahead and start?
Dr. Belomo.
Good afternoon. My name's Dr. Jeffrey Gusenhauser. I'm the Interim Health Officer, work in the Department of Public Health. With me this afternoon is Mr. Angelo Belomo, our department's Deputy Director for Health Protection, and Mr. Kobe Sky from the Department of Public Works. Last August, your board directed our departments, along with Chief Executive Office, County Council, Department of Health Services, Department of Mental Health, Sheriff's Department, Internal Services Department, and County Sanitation Districts to investigate options for reducing improper use and disposal of unused and expired medications, to include looking at the feasibility of adopting an ordinance similar to the pharmaceutical take-back ordinances that have been adopted by other counties in the state. And more recently, your board asked us to consult and work with others to explore more immediate options that could be implemented expeditiously to protect public health. So we're here today to provide you information on the work that we've done and have provided you a draft ordinance for your consideration. From my perspective as interim health officer, the harms posed by the lack of a convenient, safe, and sustainable system for disposing unused and expired medications are very serious. Right here in Los Angeles County, on average, 1 or 2 persons die each day from an overdose of a prescribed medication. The nexus between inadequate disposal of prescribed drugs and the nationwide opioid epidemic has been well established, and establishing an adequate system of disposal is recognized as a national priority. As with most serious public health problems, the solution requires concerted, united teamwork to implement strategies that are likely to succeed. Based on my professional review of the situation, I think the data speak for themselves and make it clear that we must take action soon to protect lives. We're here today to provide you factual information as you consider various options. I'll now be followed by Mr. Angelo Bellomo, who will provide additional information on our collective work.
Thank you. Again, Angelo Bellomo, Deputy Director of Public Health. Thank you, Dr. Gunzenhauser. An estimated 200 million pounds of pharmaceutical waste are generated each year. Here in the county households, we estimate 6 million pounds generated each year, and what's not being stored in medicine cabinets is either disposed of in the trash or by flushing into our sewers. EPA estimates that people in the U.S. use more than 3 billion needles, syringes, and lancets each year. And in our county households, we estimate there are 90 million sharps used each year. In our county, from 2000 to 2009, there were 6,200, that is 6,265 drug-related deaths, and 61% of these involved commonly abused prescription or over-the-counter drugs. Pharmaceuticals have been found in water supplies, drinking water supplies, that serve at least 46 million Americans. Let's just talk a little bit about why trash disposal is not a solution. First, disposing of sharps in the trash is illegal, and even when we don't specifically mention sharps but promote trash disposal, sharps invariably will find their way into the trash because it's a complicated message that you can get rid of your pharmaceuticals but not sharps. Second, crushing pills and mixing them, as suggested by the pharmaceutical industry, is complicated and could lead to increased exposure through inhalation of the pulverized medications and through skin contact. In addition, the Drug Enforcement Administration regulations say that mixing controlled substances in the manner prescribed does not meet the non-retrievable standards. And what I'm really referring to here is that often as this debate has unfolded across the country, drug manufacturers talk about disposal and suggest that those who want to get rid of their unwanted medications crush them, mix them with coffee grounds or with kitty litter, mix them with water, put them in a plastic bag, and then toss them in the trash. And that's a very complicated message, and we also don't believe it's an appropriate method. Okay, encouraging trash disposal of these wastes is also contrary to board policy on recycling, waste reduction, and sustainability, and also inconsistent with board-adopted policy in 2008, which supported the principle of extended producer responsibility, encouraging manufacturers of products, especially difficult-to-manage projects such as products such as these, to assume greater responsibility in the end-of-life management of the product. Getting to the toll on public health and the environment, nearly 75% of residents who misuse pain relievers obtain them from relatives or friends. The National Institutes of Drug Abuse note that the number of drug overdose deaths have tripled since 2000, consistent with Dr. Gunzenhauser's comments, and is now the leading cause of injuries resulting in death. And it actually surpasses the number of deaths by both motor vehicle crashes and firearms. According to EPA, people at the greatest risk of being stuck by used sharps include sanitation and sewage treatment workers, janitors dealing with trash, and housekeepers and children. DPH conducted a survey in preparation of the work we've been doing with the Extended Producer Responsibility Work Group, in which we surveyed 1,000 residents at either the Department of Health Services clinic pharmacies, Ralph's pharmacies, as well as online. And the survey results were very interesting. We found that 60% of the respondents have medicine in their home they no longer need. 3/4 of the survey respondents believe putting medicine down the toilet or sink is harmful for the environment. And more than half of the respondents believe that putting medicines in the trash is harmful. Consumers really do seem to prefer 69% of them, almost 70% of the respondents would prefer to use a drop-off bin located in a pharmacy. It seems very intuitive to them. Okay, now we go to slide 10, is it? Mm-hmm. Okay. Now, there have been a string of developments in our country over the last 5 to 6 years, dealing first with action by the U.S. Congress in 2010. It was the Secure and Responsible Drug Disposal Act. And that act basically expanded the available options to collect and dispose of controlled substances in a secure, convenient, and responsive manner. That was followed by a report in the state of California, CalRecyde, to the legislature, wherein CalRecyde reported recommendations for home-generated pharmaceutical collection programs in California. That was 2010. In 2012, Alameda County adopted a take-back ordinance. This was the first local ordinance in the country. And that ordinance required pharmaceutical companies to design, fund, and operate a safe pharmaceutical drug collection and management program. Between 2013 and 2015, there were several bills submitted in the legislature, considered in the legislature, and it was really based on the recent direction at that time from the federal government signaling that these types of programs made sense. But there's always been strong opposition from the drug and sharps manufacturers, and to date those bills failed to pass. As a result, in addition to Alameda, a number of other jurisdictions have sought solutions at the local level. In 2014, the Drug Enforcement Administration passed regulations that allowed for take-back programs. And in 2015, the Supreme Court, who the Alameda Ordinance was eventually brought to the Supreme Court, declined to hear the Alameda case. On May 26, 2015, the Supreme Court decided it would not review the case and leaving the Circuit Court's decision in place. In LA County, we've had a number of developments as well, but first let me just mention here that federal agencies that are listed here, DEA, FDA, EPA, and the National Drug Control Policy, Office of National Drug Control Policy, they all reference in their materials the benefits of take-back programs. The county has developed over the years, maybe over the last decade, a number of different ways of dealing with drugs and sharps. And I won't go into detail, but we do have 21 sheriff stations which continue to host drug and sharps bins. We have the annual household hazardous waste collection programs that the Department of Public Works implements. There's on the order of 60 of these every year, and they're located in multiple directions so that there's rarely a week that you couldn't find one of these events going on somewhere in the county. There's also 77 sharp collection locations, and despite these efforts that the county has made at county expense, it still is only scratching the surface of the need that we have to meet for the 10 million residents we have in the county. The extended producer responsibility, there was in 2008, the board adopted a resolution supporting extended producer responsibility, which again holds manufacturers of products responsible for the end-of-life management of those products. Several similar efforts that predated our consideration of pharmaceutical drugs was the way in which paints were handled, Mercury thermostats, and mattresses. Those are all handled by similar take-back programs funded and organized by manufacturers of those products. Let's see. Okay, so let's now move to something a little more recently. In 2014, the board adopted a roadmap to achieve sustainable waste management future. This was prepared by Department of Public Works, but it really represented a wonderful development in the county and referenced product stewardship and extended producer responsibility as priority areas. At that time, the board adopted an initiative to explore the feasibility. This was the first time we had looked at the feasibility of a county extended producer ordinance for materials such as pharmaceuticals and needles. Let's move on to the next slide. Let's go to 17. With regard to the current effort, I think many of you may remember that about a year ago we launched into looking first at the feasibility of a take-back program within the County of Los Angeles. And as we reported back to the board a year ago, we were then directed to draft an ordinance, a take-back ordinance for consideration by the board, and to use a very robust stakeholder engagement process so that we didn't leave any stone unturned. So now we're on stakeholder engagement. This really lists the various organizations that we aligned ourselves with and solicited input from. So we had the county work group consisting of all the agencies that Dr. Gunzenhauser had referenced, and then we had the stakeholder group, which was comprised of all the key stakeholders that have responsibility or value in terms of seeking input. Additionally, we held 2 public meetings in addition to meeting 4 times with the stakeholder group. And in addition to those 2 public meetings, we also reached out to a number of contract cities and other jurisdictions soliciting their input during the consideration of the ordinance that was under development. And slide 18, Kobe. All right, so the county ordinance that is before the board requires manufacturers to develop and finance the program. It provides flexibility in that it basically establishes a criteria for determining what is convenient, safe, and sustainable collection program, but it's entirely up to the industry. We thought it was important to leave the option for how these criteria would be met to the industry. And it also includes voluntary participation by pharmacies and other retailers if they wish to host drop-off bins. Now, we were directed, is this here? Okay. We were directed by the board on May 17th, which was the last time we had appeared before the board, to look at more immediate options. If you consider the ordinance itself, if the ordinance is adopted, it then takes about 12 months for us to receive a plan from the stewardship organizations. And the board was asking, what could we do in the way of more immediate options that would result in take back even sooner? So we met a week later with the California Retailers Association and members of the pharmaceutical and sharps manufacturing groups, as well as members of our county health agency. And we considered potential options. And the industry submitted a revised proposal for public education in lieu of the ordinance as a part of that outreach to the industry. And it included advertising the existing sheriff stations. Again, this was really at county cost in utilizing county existing infrastructure, and also advertising the DEA collection events which occur periodically. And then as a last resort, the industry was saying the disposal of drugs in the trash would be their last resort. Based on the feedback provided and the further analysis of the advantages and disadvantages of various approaches, a report was developed and submitted to the board and included 3 options. Option 1 was the option that we were recommending to the board. It would amend the ordinance to require responsible stewards launch a public education and outreach campaign within 60 days of the effective date of the ordinance and conduct quarterly take-back events that would occur in each supervisorial district until implementation of approved stewardship plan. So this would be an early option to get take back really moving in a much more consistent way while we waited for the stewardship plans, which could take about a year to implement. There were two other options we considered. I won't really mention them. They were included in our report back to the board, unless there are questions. Slide 20. In the event that the board does adopt an ordinance, anytime you bring one of these take-back programs in as an ordinance within a local jurisdiction, there are benefits. They provide safe, convenient, and sustainable collection and disposal options. This was the goal in drafting the criteria, and we really think we were able to draft an ordinance that would achieve these. It's free to all residents. It's convenient. It would reduce drug misuse, abuse, and poisonings. It would reduce injuries and deaths, and it would reduce the impact that these substances could have on the environment. We've been supported in our efforts, again, as part of our outreach to the cities. We've received support letters from a number of cities in each of our 5 supervisorial districts that are listed here. So we've got the county well covered here in terms of city participation and interest in the ordinance. And we've also received very broad-based support from government officials, including those that are listed up there, League of Conservation Cities, EPA, CalRecyde, and so on, labor and professional organizations that are listed as well, and environmental and advocacy organizations. You can see some key ones there that I think the board has heard from over the last year that we've been working in earnest on this development. And then the handlers of solid waste and the wastewater agencies who are concerned about the impact pharmaceuticals could have on wastewater and the waste stream that they manage. So in summary, the ordinance would provide the board with the opportunity to provide safe, convenient, and sustainable options for LA County residents. It would provide protections for the environment, and it would protect the public's health and help save lives just by taking these unwanted medications out of the availability that they currently provide. And with that, I think unless Dr. Gunzenhauser or Kobe Sky from DPW have any concluding comments, we just turn it back to you, Chairperson.
Are there any questions from board members on this item at this time? Because we have several witnesses. I just want to thank the staff and our county council and others that were working so hard on this. Feel like this has just been going on for too long. I remember distinctly talking about it at a sanitation district meeting and very enthusiastically letting folks know where the county was headed. It appears our gears are slowing down a bit, not because some of us want to, but that's such is the business of the board. I do want to say that there are many people in my cities that have approached me that are very enthusiastic about this and want to begin the process of at least starting something and then coming back, hopefully in November, with something very strong. So
Thank you.
I just want to say that because I know how hard you all have worked with our staffs, and I know with my staff in particular.
Thank you very much, Supervisor.
Appreciate it.
Thank you.
So, if there aren't any questions from folks here, we can ask for, we have several speakers on this item. And I'll thank you, staff.
Thank you.
We have Paul Koretz, a city councilman from Los Angeles, who will be awarded 3 minutes. Sorry for having you wait so long through all the... Prerogative of the board. Thank you, Councilman.
Hello, Chair Solis and fellow supervisors. I thank you for the opportunity to speak with you today, and good to see old friends up here. I particularly want to thank Supervisors Antonovich and Solis for bringing this historic and important motion forward today. And I'm here to support the ordinance and option 1. This is personal to me because I'm a diabetic and at various points in my life, I've had to use multiple syringes and needles every day to check and maintain my blood sugar levels. As an elected official, it's a bit embarrassing to admit publicly that for the longest time, I didn't know what to do with those needles when I was done. I never really focused that much on the issue. I did know I obviously didn't want to poke any of our hardworking sanitation folks with needles or have medicines leaching into our landfills, so I would fill containers and store them in my garage. A little while ago, I tripped over the UCLA program that collects toxic waste, including sharps, and the next time I had to give a speech at UCLA, I brought a carload of sharps that were collected over 15 years and dropped them off there. Now, I can promise you the average person is no less clueless than me. The difference is that I believe most flush their medicines down the toilet, throw their sharps in plastic trash bags, and in general approach this issue in a dangerous way. And not because they had a malicious intent, just because they were confused as to what to do with their leftover medications and sharps. The more I've learned about the problems, the more I realize we need to do something, especially as our drought gets worse, and we need to do everything in our power to reuse our sewage water, and also to keep medicines out of landfills where they can damage our groundwater. When I heard about this motion, I was thrilled. I know there have to be thousands of people out there just like me. This protects senior citizens and children and dogs and cats and first responders and nurses, Teamsters and other sanitation workers, surfers and drug abuse prevention groups. Best of all, it will support good jobs right here in LA County at the thermal conversion facility in Paramount. It's a win-win. My fellow city council members, David Rue and Jose Huizar, joined me in introducing a resolution of support for this effort from the city of Los Angeles. And I'm here to tell you tomorrow, after you approve this, those same council members will join me in introducing a motion for the city of Los Angeles to opt into your program. It's groundbreaking, it's historic, it's good government, it makes good fiscal sense, and I thank you for supporting this motion today. Thank you.
Very much, Councilman. Sorry we had to delay your testimony. Okay, we have Mary Alice Cedillo, Stephen Johnson, Jim Smith, Carlos Gutierrez, Jamie Garcia, or Jaime Garcia, Dr. Genevieve Clavral, sir.
Yeah, I'm going to be giving my my time to another Heal the Bay staff member.
Okay. Let's make sure we get that recorded. Okay. Go ahead, next speaker. Just state your name for the record, please. Ma'am?
Good afternoon, Chairperson Hilda Solis and supervisors. My name is Mary Alice Cedillo, and I'm representing the California Alliance for Retired Americans. And also I belong to the Gray Panthers, which is another grassroots organization for seniors. And we are here today, and I want to say that that was an excellent report. It really tells all of the facts and fits the issues that we're facing with the Drug Take Back program. The medications that are flushed down the toilet and end up in our drinking water, it cannot be easily removed from treatment facilities, and there are adverse effects to our sea life and the aquatic organisms. The home medicine cabinets represent a prime source of the prescription drugs that make their way into the community. Prescription drugs lead to crime, abuse, and overdose. Our seniors find it difficult to dispose of sharps properly or to pay for expensive mail-back programs. Instead, sharps are hoarded unsafely in old milk jugs or even flushed. We need a safe way of disposing of sharps. Pharmacies are convenient locations to return unused medication. There is a minimal cost to drug companies to pay for drug takebacks, $1,000 or less annually for pharmacies in Canada. The ordinance has a clear definition for responsible steward that focuses responsibility on the manufacturer of the medicine or sharp, and also clearly defines who the county can hold responsible as a steward if the manufacturer cannot be defined. This is a win-win situation for public safety and especially for our seniors. So we ask that you support this issue. Thank you for the pleasure of your time.
Speaker.
Thank you, Madam Chair. My name is Carlos Gutierrez. Members of the board, I represent an organization called the Consumer Healthcare Products Association. We represent the over-the-counter medicine manufacturers. Our companies are comprised of organizations that are very large, all the way to very much smaller companies that employ 100, 200 people, many in Los Angeles itself. We as an industry agree that disposal as an issue is important. We agree that getting unused, expired, or unwanted medications out of medicine cabinets is an important effort. I think we just disagree on how to go about resolving that issue. I want to thank all of you and your staff members and the staff of the county for deliberating this issue for some time now over the course of the last few months. And I think a lot was put on the table, a lot of good ideas, a lot of differing ideas. I can tell you with confidence that we as an industry feel we do have a role in resolving this issue. We want to play a role. We want to be part of the solution. And we have put forward what I think is an unprecedented effort in this regard, and that is to, in partnership not only with us as an industry, but also with the retail community, the grocers, pharmacists, and really doing a robust education and awareness campaign. Number one, to create awareness, to provide knowledge, hopefully change attitude, and at the end of the day, change behavior. And we're confident we can do that. We've done that on a number of other abuse issues, if you will, and would welcome the opportunity to do that here with this county. We do think the proposal of a formalized drug take-back ordinance is inexpensive, it's ineffective, really inefficient, and as Alameda County has shown, just doesn't work.
Thank you. Next speaker, Mr. Garcia.
Good afternoon, Madam Chair and members of the Board of Supervisors. My name is Jaime Garcia with the Hospital Association of Southern California, which represents over 85 hospitals in Los Angeles County. I appreciate the opportunity to provide comment to you this afternoon on this drug take-back program, but I also need to recognize the public works and public health staff that invested time and energy in developing the stakeholder process that provided an opportunity for interested parties to provide comment and questions that would be addressed. That brings us here today as part of this debate here. We believe that this ordinance offers consumers both a safe and convenient method to dispose of their sharps and unwanted drugs. This option addresses the missing link in the community as we collectively seek to address the rising opiate abuse within the Safe Med LA Coalition. I want to thank you for your time, and the Hospital Association really encourages you to approve today's motion as we work with public health and public works and all the other environmental groups to really address this issue that brings us here today in terms of the concerns that have been highlighted in the earlier presentation. Thank you.
Thank you. Next speaker.
Yes, good afternoon, Board of Supervisors, Dr. Geneviève Clavrol. Well, I'm glad to see that ordinance because right now the county pay, and we have few places where you can dispose sharp, but the people who are staffing those places are not very nice people, and depending how they feel that they go to give you some, an empty sharp container or not. So I think that's the first thing we should be looking at, because I am also a diabetic and I use about 7 syringes a day, so I am concerned where you drop it. The same with the unused med. But if I hear one more time about drug abuse and opiates, I'm getting very concerned about that because everybody is talking about it. And actually, the state of California is the state who purchased the least opiate in the entire United States. But we are the one who are looking at it the most. Those have to look at it, but we also have to look at the people who are in pain and we need the medication to survive and have a decent life. You know, I don't know who provide the sharp container in Las Vegas, but every bathroom in Las Vegas have a sharp container box everywhere you go in a casino. So I think in Las Vegas can do that. Maybe we can have few places where we can have, you know, I don't know if it's a pharmaceutical company who's doing it or not, but I think some of the drug company and the pharmacy should also take back the drug who are not used. I think that part of their marketing plan should be part of their marketing plan. Thank you.
Okay, we have Leslie Griffin.
Greetings, supervisors. Thank you so much for the opportunity to speak before you today. My name is Leslie Griffin. I'm the beach water quality scientist for Gila Bay. As we've heard, California state law makes it illegal to throw home-generated sharps into garbage or recycling containers. However, in LA County, there are currently only a few designated locations where safe syringe disposal is available, and it simply is not enough. These sharps make their way to our shores from our streets. Back on Friday, March 11th, I personally collected 6 sharps on the half-mile of beach between the mouth of Ballona Creek and the Culver Boulevard storm drain. And the following morning, after a storm event, I walked the same stretch of beach to find 11 new syringes. I have photos of some of these here with me today, which I'll provide you. Last fall, we also saw these items wash ashore from a wastewater treatment sewage spill to our bay that I'm sure you heard about. Sharps are being disposed of in our sewers and storm drains and trash cans, risking the public health of our beach-going population and our sanitation workers. If this ordinance keeps even a fraction of those used syringes out of our storm drains and sewers, Gila Bay sees the ordinance as a more than worthwhile effort. Together, we have signatures from about 1,300 of your constituents that support this ordinance and want to see it pass. I have those with me as well today. This ordinance was created through a thorough and inclusive process involving diverse stakeholders. It is ready as is, with no need for further delay. LA County has the opportunity today to be a trailblazer in regards to this form of extended producer responsibility. Gila Bay sees only benefits for the people of our county and encourages all supervisors to assist their constituents by giving them a safe and convenient way to dispose of their unsafe pharmaceuticals and sharps. Thank you again very much for your time.
Thank you. We have Jim Smith, Marissa Watkins, Jimmy Jackson, Leslie Griffin. Oh, that was Leslie. That was Leslie. Thank you. And Rachel Horning. Go ahead, ma'am. State your name.
Thank you, Madam Chair. My name is Marissa Watkins. I work for the Pharmaceutical Research and Manufacturers of America, the association that represents the nation's innovative biopharmaceutical companies. First, I would like to thank the supervisors and their staff, department staff, and all other stakeholders who have worked on this important issue over the past several months. We've appreciated the opportunity to engage with the county on these important issues. Pharma has offered concrete solutions to the county's concerns about how residents should deal with unused and unwanted medicines and sharps. Knowing that we play a role, we have put forward a comprehensive public education program that can deliver real results, unlike the draft ordinance that will not work as envisioned. Pharma opposes this ordinance, which seeks to mandate pharmaceutical and sharps manufacturers to fund and administer a new program to specially collect and dispose of unused pharmaceuticals and sharps products based off of the unsuccessful Alameda program. Instead of implementing an unsuccessful program, Pharma encourages the board to support the industry's education campaign, which can be up and running in a matter of weeks and can reach the entire county. For these reasons, we respectfully request the board oppose the ordinance and instead form a true public-private partnership with the industry and move forward with our proposed reasonable measure of public education that can achieve the results. Thank you for your time.
Thank you. Next speaker.
Good afternoon. My name is Jimmy Jackson. I'm the Senior Vice President of Public Policy for Biocom. Biocom is a life sciences trade association representing over 750 companies across Southern California, with permanent offices in San Diego, Washington, D.C., and as of 2 months ago, Los Angeles. It is important to note that although Biocom registered a formal letter of opposition to the original proposal, we have not been part of the lobbying efforts on this ordinance until now. As you are probably aware, Biocom is a partner with the county, the LA EDC, and many other stakeholders to try and build and coordinate the bioscience hubs within Los Angeles County so that the county can better realize the economic benefit of the industry and the jobs it creates. I can think of no greater threat to that effort than the passage of a flawed ordinance which effectively sends a message that the industry is not welcome in this county. The burden of this proposal and others like it disproportionately and adversely affect the very small companies the county is trying to encourage, companies that overwhelmingly make up the majority of Biocom's membership. Biocom urges the board to reject the ordinance and instead work with the industry on education alternatives that can be up and running very quickly. Thank you.
Thank you. Thank you. We have more speakers. Jim Smith, Rachel Horning, Carrie Hartkin, Craig Cadwallader, Alex Davis, and David Pedersen. Go ahead, sir.
Good morning, Honorable Supervisors. Excuse me. My name is Craig Cadwallader, and I'm speaking on behalf of the Surfrider Foundation South Bay Chapter and the thousands of our members and supporters from our chapter's territory, which extends from Bayona Creek to San Pedro and as far inland as Montebello. I've been a resident of Los Angeles County for nearly 4 decades and highly value a clean, safe, and healthy Santa Monica Bay and Los Angeles County beaches. I support this ordinance. We need a pharmaceutical and sharps ordinance in Los Angeles County to put the responsibility of providing means of safe disposal on the producers of these products. As surfers, beachgoers, swimmers, and county residents who like running on the beach or swimming in the ocean, our members and supporters feel it's important that the ocean we swim in is clean and that hypodermic needles don't end up on the beach. I support the proposed ordinance and its requirement for stewardship plan development. Without appropriate collection options, consumers are more likely to flush pharmaceuticals down the drain. Currently, wastewater treatment plants are unable to filter out all pharmaceuticals, meaning chemicals from these drugs are ending up in our waterways and the ocean. We also need producers to undertake stewardship plans for the safe disposal and collection of hypodermic needles. Without proper disposal mechanisms available, sharps end up being thrown in the trash or down the toilet, leading to injuries and beach closures like the one last fall from the Hyperion treatment plant. I urge you to introduce the ordinance today and pass it at the next meeting. We can't afford any more delays, and it's time to protect LA County beaches and waterways for all. Thank you.
Thank you, sir. Next witness.
Great. Thank you, Chair Solis and supervisors. My name is Carrie Hartkin. I am with AdvaMed, which is the Advanced Medical Technology Association. We're a national trade association representing manufacturers of medical device and diagnostics, including manufacturers of sharps. We appreciate the opportunity to work and engage with you on this important issue. However, we do oppose the ordinance and option 1 recommendation currently before the board. We don't believe an Alameda County style approach is the most prudent one. Instead, as you heard earlier today, we are part of a broader industry coalition offering up a comprehensive education plan that we think will deliver real results in helping residents deal with their used sharps. We respectfully urge the county to reject the ordinance and instead pursue an approach that would result in a true public-private partnership and yield real results in a more cost-effective manner. Thank you.
Thank you. Next witness, please.
Good afternoon, Madam Chair and members of the board. My name is Alex Davis. I'm the Legislative Affairs Manager at VICA, and collectively we represent over 400 local businesses and nonprofits throughout Los Angeles County. And over the last year, VICA has provided comments and shared our thoughts supporting the education alternative to an EPR ordinance. We acknowledge the original intent of the motion and in the spirit of community safety and economic development, believe that the alternative is the best way to provide a safe, viable, and meaningful option for the county. Closing the information gap will provide a great outreach program to the benefit of all residents. Thank you.
Thank you. Next witness.
Thank you. Good afternoon, Madam Chair, members of the board. My name is David Peterson. I'm the General Manager of the Las Virgenes Municipal Water District, also representing the California Association of Sanitation Agencies. I'm here to speak in support of the ordinance. The ordinance will establish a convenient means for county residents to dispose of unused and unwanted pharmaceuticals and sharps, and importantly, prevent their improper disposal, such as flushing down the drain or putting down the drain. As an owner-operator of a wastewater treatment plant that treats the sewage from a portion of the county, I can tell you that the improper disposal of sharps and pharmaceutical products is a real problem that needs to be addressed. We see pharmaceutical compounds in the water entering our plant, and the plant, as most in California, are not equipped properly to remove these compounds. This means that the compounds pass through the treatment plant and on to receiving waters that we're trying desperately to protect. It's widely recognized that source control is the best means to keep these pollutants and others like it from entering our environment, and this ordinance would establish a valuable source control program. The ordinance and the process was put together by a county team that did an excellent job. It was an open process. Stakeholders were invited to provide their input, and their input was incorporated along the way. I would ask that you support the introduction of the ordinance and support its adoption. Thank you.
Thank you. I'd like to call on again Jim Smith, Rachel Horning, Kathy Patterson, Esther Pagulayan, Susan Mayer, Vishnu Subramaniam, Heidi Stanborn. Please remember to state your name before you start.
Hello, my name is Susan Meyer, Chair Solis and supervisors. I'm here to say that I am in support of the ordinance in option 1. I'm a diabetic. In the beginning, actually for years, like the good councilman said, I didn't know what to do with the sharps, and I didn't know what to do with the needles where I tested my blood. So I started hoarding them and started to stick everything into water bottles, and I just didn't know what to do with it. And then, so I do believe in this ordinance, and even at 4 times a year, quarterly, is really not quite enough, but it's a great start. I'd also very much in support of this ordinance in option 1 for the pharmaceuticals, the medications, and what to do with the medications. I think everybody has extra medications stored in their medicine cabinets. I'm sure just about everyone in this room has medications in their cabinets that they don't use anymore. I know when I had a dental surgery, I was given a prescription for pain medication, All I needed the pain medication for was for 1 or 2 days after the surgery. And after that, well, I had a whole bottle of pain medication, so I put it up with the other ones that I had. And I think they're still sitting there. I don't really know what to do with them. So I think this ordinance is very important. Thank you.
Thank you. Go ahead.
Madam Chair, members, I'm Heidi Sanborn at the National Stewardship Action Council. There was a great staff report, and you saw the long list of support for this ordinance. It's basically the entire community. It's the workers, it's your staff, it's the environmentalists, it's the nurses. There's so many people. But there's really only one group that really doesn't like it, and that's the people that are going to have to pay, and that's pharma. So that we ask why there's been 5 delays. This vote should really be easy if the concern is public health and public safety. So we're hearing there's another motion to delay possibly and maybe making this voluntary, but I want to remind you that the pharma industry has a credibility problem. The LA Times reported that CHPA has been scaring seniors and calling them. They sent letters to you. We've gotten copies of these, as have the papers. And we know that this has already been litigated to the U.S. Supreme Court. This is 0.3 cents to 1 cent for every $10 sold. They sold $8 billion estimated into this county in a year. This is not a cost burden on this industry. However, it is on this county. Pushing AB 45 is another tactic to preempt local ordinances in the state when we can't come to agreement at the state level. But getting to an agreement means we have to have parties that are willing to get to yes. We are willing to get to yes. Mr. Gutierrez referenced Alameda County. Alameda flew their staff down at the last hearing to make sure you knew that their program is working now in spite of the sabotaging that has been going on by the industry. They've ordered bins, things are now working, and they're having one-day events. In Mexico, they now have 4,400 collection bins in pharmacies, and they collected 526 tons of medicines in a year. Are you telling me that we cannot do that in Los Angeles and in this state? Voluntary does not work. That's why we're here. The definition of insanity is doing the same thing over and over again. I urge you to adopt this ordinance, try something new, try something that's proven to work. We urge you to stand up for the people. Thank you.
Hello, my name is Kathy Patterson. The drugs and things that pharmaceuticals, I usually put them in a bag or something unless the center or something has some kind of take back. But I do believe that we should pass this ordinance because these drugs seem to be like some kind of hazardous waste material. And if the pharmaceutical companies are not going to make these drugs more safe after their use or even during their use, then they should take their responsibility without being told or some kind of legal action that they need to take responsibility for their products. They get billions of dollars for to make these drugs, and I think the public deserves to have a safer environment in the water, safer environment in the way that we have to deal with this kind of thing. I do believe that there should be more done by the pharmaceutical companies, as well as making the drugs more affordable to the people and maybe have alternative drugs that wouldn't be so hazardous. I do thank you for your time, and I appreciate your efforts. Thank you very much.
Thank you.
Good afternoon. My name is Vishnu. I'm here with the California Alliance for Retired Americans. I'm the Southern California organizer for CARA, which is made up of 950,000 retirees. We are a grassroots group in support of the drug take-back ordinance. I have one member who is not here today who didn't know what to do with her sister's medicine upon her sister's passing. Because of her work schedule and the distance she had to drive, it took her several weeks to drop off the unused medication. I have another member, also not here today, whose son was able to get into her medicine cabinet when he was visiting on a family vacation. When he left, she found many of her painkiller prescription bottles emptied. This was a son who had a previous drug addiction. There are many stories like this with seniors and retirees. They need a safe, convenient location that's close to their home, ideally the pharmacies where they purchase their drugs, to dispose of the bottles and bottles of prescription drugs that are lying around their home. You've heard a lot from the industry who doesn't provide solutions, insists on ineffective solutions, and would rather do nothing than pass this ordinance today. I'm asking you to ignore the industry, ignore their influence, ignore their frivolous ideas, ignore their baseless arguments, their purposeful delays, their alternative motions, their ineffective solutions, and essentially try to distract all of you from passing something that would help the public. We're asking you to implement option 1 as soon as possible. We're asking you to provide a place for seniors to take back their drugs, their sharps, their unused medication, and ask you to implement something today. Thank you.
Thank you. Esther Pagulayan, Tish Ochoa, Sharon Nakamoto, Craig Campio. Sir, state your name.
Thank you, Supervisors. My name is Craig Hampel. I'm a board member of the California Product Stewardship Council, and I want to thank you for your considerations today on this ordinance. And I strongly support an ordinance that will do a great job here with extended producer responsibility. The California Product Stewardship Council represents over 100 local governments in California who have adopted resolutions to support extended producer responsibility. That's about 63% of the California population. Your staff has done an exemplary job of reaching out to both the industry and to residents and local groups. They've invited input and comments. They've done a lot of revisions. They've discussed this openly, and they've had a very cooperative approach, and I just want to recognize their great work. With due respect to the industry representatives and lobbyists, they have focused on failure. They've distorted facts. They've ignored the success of existing programs, not only in Alameda County, but around the world. They've refused to participate. They've come up with other unworkable programs that are not going to get the job done. Your efforts can protect your county sanitation and recycling workers. They will help the homebound. They will help diabetics. You've heard up here today how difficult it is to get the proper information. Think of your custodial workers, even your pet owners who have to use these materials and get rid of them. We have a lot of home health care workers that come to us for help. They're in the industry. So I appreciate a comprehensive approach that looks at success. We don't need a voluntary program. We need real working models. Not only education, but we need things that will support the public good. Thank you very much.
Thank you. Next speaker.
Good afternoon. My name is Mrs. Pagulayan. I am a retired nurse, and I have to tell you, when I was in training, we don't have any problem of this kind, because I was trained that we have to do it, the sterilization of the needles and syringes. But now that we are in a modern way, because of the technology, we have a lot of problem. That the public needs to be educated, to be instructed by own physicians and everybody who are in the healing profession, because the public is not fully aware of the damages, the sickness, the dangers, and the deaths of so many people. So I appreciate to listen to all of you who are speakers and who are accepted their effort to improve the environment and the health of the people. And I thank you very much.
Thank you very much, ma'am. Next speaker.
Hi, my name is Tish Ochoa, and I'm a member of the California Alliance for Retired Americans. My mom is 80 years old. She has 78 descendants. She takes 10 medications, and they like to visit her. Now, I don't know what pharma can teach her that she doesn't know already, but if it's very simple, if they could just put on the bottle, return any unused to where you purchased. Very simple. Why do we have to make this harder than it really should be? But I'm in support of the ordinance, and thank you for allowing me time to speak.
Thank you. Next speaker.
Hi, good afternoon. My name is Sharon Nakamoto. I'm here with the California Alliance for Retired Americans, and I was more fortunate than all of you. I got to go down to the cafeteria for lunch. But I just want to say that you're hearing from a lot of people who have a way to get here. I want you to be aware of people that need to use access to go to their doctors or their pharmacy to pick up their prescriptions. They can't just call Access and say, oh, you know, I just remember the sheriff's department is taking drugs today, so I need to go over there. Because a lot of times Access will take you there, drop you off, and then you have to wait an hour or so to get picked up again. So I have a friend who uses Access, and she, unfortunately her son just passed away this past year, and her son was on different medications, and she, with all the other things that she's had to deal with, she still has his medications and doesn't, and it would be so much easier for her when she goes to pick up hers to be able to take all of his to the local pharmacy to drop it off. Thank you.
Thank you, ma'am. Appreciate that. Lorenzo Rios, Donna Meredith, Sarah Radcliffe, Bill Hickman, Susan Klimusko. Go ahead, sir.
Sure, thank you. Hello, honorable supervisors. My name is Bill Hickman. I'm with the Surfrider Foundation. I support this ordinance, specifically option 1. We need a pharmaceutical and sharps ordinance to put the responsibility of providing means of safe disposal on the producer of these products. Extended producer responsibility and source reduction such as this is the key to eliminating litter and pollution. As a surfer and father of 2 daughters, this is important to me because the ordinance can help keep the ocean we swim in clean and that needles don't end up on the beach. In 2012, some Southern California scientists concluded in peer-reviewed research that bottom-dwelling ocean fish are highly exposed to hormone-disrupting chemicals near wastewater discharge sites off Los Angeles and Orange counties. We should be doing all that we can to keep these chemicals out of our ocean, and this ordinance is a step in the right direction. Few people mentioned education and awareness. Well, they don't have the same impact that an ordinance does. We have seen it many times on other issues such as plastic bag litter. The Board of Supervisors was a leader early on
families. When I found out he was doing that, I bought a safe and I locked mine up. But this is very tragic. to happen to many people I know now today. Thank you for your time.
Thank you, ma'am. Next speaker.
Thank you, Madam Chair, and good afternoon. My name is Sarah Radcliffe, and I am the President and CEO of the California Life Sciences Association, CLSA. CLSA is the statewide voice for California's life sciences sector and serves over 750 biotechnology, pharmaceutical, medical device, and diagnostic companies, research universities and institutes, investors, and service providers up and down our state, including here in Los Angeles. California's life sciences sector directly employs more than 281,000 people and indirectly employs another 581,000. In Los Angeles County alone, over 56,000 are directly employed in the sector. The ordinance being discussed today proposes a stewardship program that assigns the responsibilities of county government to private industry. The sale of pharmaceuticals and sharps products in the United States is extremely complicated. It involves manufacturers, wholesalers, doctors, hospitals, nursing facilities, insurance companies, government programs like Medicare and Medicaid, as well as thousands of retail outlets from pharmacies to corner stores and ultimately the patient. Placing the entire burden of waste on the manufacturers ignores this complex supply chain and attempts to address this matter without any significant input from and participation by other stakeholders. This ordinance is also a radical departure from other recycling programs in place because it imposes unrecoverable costs on a single industry for its implementation. The ordinance is also the first of its kind to add a mandatory sharps take-back program. There is significant risk in having disposal kiosks for used sharps due to potential hazardous material and non-sharps waste being deposited in them. CLSA respectfully urges the county to reject the proposed ordinance and option 1 recommendation and instead consider support for robust education programs that are proven best practices for the safe disposal of pharmaceuticals and sharps. Thank you.
Next speaker.
Lorenzo Rios, representing CARA. I've been hearing the pharmacist company calling, saying it's too much money to spend on an ordinance like this. Yet they make billions in profit. And to me, profit means that's the money you earn after you pay all your bills. So there's a clear profit, and they can afford to pay for the take-back program here in LA. How much does it cost? If you spend $1 million out of $1 billion, it's nothing. But they say it costs money. All of a sudden, they want to educate us about how to dispose your pills and deal. Why didn't they do that 10 years ago? Why now, since LA is trying to pass an ordinance to take back the drugs and sharp program, are they coming with this so-called educational program? They agree it's a necessary.
It's difficult for me to dispose of my medications when my doctors change my medications. As a district health officer, we had custodians with needle sticks before we had sharps containers, or when someone forgot to put sharps into the trash. And we had patients who walked several miles to get to the county public health centers. And I'm sure there are some who still do. And a local pharmacy would be closer for them. The logical drugs in the home are dangerous, as people have indicated. The logical place to dispose of medication and sharps is the pharmacy where they were purchased. When we buy electronics, if they don't work, we take them back to the place where we bought them. The logical funder is the drug companies. The cost is a few cents per prescription, and their profits are unbelievably high. There's no sheriff's station near me, and the toxic waste collection site has limited days and hours. I urge you to pass an ordinance that would require the pharmaceutical and sharps manufacturing companies to pay for drug and sharps collection and disposal at all pharmacies and free mail-back envelopes. if the pharmaceutical companies are so strongly wanting education as they were claiming today, why haven't they already done it? And I want to thank the county employees and stakeholders who developed this ordinance. Thank you.
Thank you. Next speaker, Ruth.
Ruth Sarnoff. I want to have some thought put into, for one thing, about the exporting of this kind of hazardous waste around the world, because we have a history, like when we outlawed tris in pajamas because it was a cancer-producing flame retardant, and then we shipped it all over the world for years and years and years. I think we should be sure that we're not sending any of this at the tail end of this whole process to some other country where poor people in some other country will be affected. That's number one. And I also think the protection of the people who do work in the collection of this material is important. I think we should, if it's possible, that CEQA, the sanitation department, and some others look into the problems with disposal of this. I think that the industry should pay in for the cost of anything that they do not provide in kind, like at a pharmacy or whatever. And I'm concerned what hospitals, rest homes, and lots of other places where people are treated, and in-home care and that kind of thing, that we have some simple solutions for these people. And I think looking at it in a broader sense, from the inception of the production of the drug and the things all the way down to the final resting place for it. We're dealing with serious water quality, air quality, soil quality, all kinds of things. And as you know, the terrain changes from time to time. An earthquake or any other kind of thing does affect what happening in real time. And thank you so much for your time.
Donna Meredith, Bob Shaw, Allison Reagan, Lauren Achim, and Sheila Ward.
Hello, my name is Bob Shaw, and I'm the president of MWS. We operate a full-service collection, treatment, and disposal medical waste facility in the Los Angeles County. Our management team has over 45 years of experience in this field, and collectively we have planned, permitted, and built and operated dozens of facilities both inside California and across the country. Our current facility, located in Paramount, California, has been operating continuously since 2010, and we enjoy perfect compliance record. We are keenly aware of the safety and environmental concerns associated with improper disposal of pharmaceutical wastes. California regulations require that these materials be treated via incineration or high heat to ensure complete destruction. Until recently, that meant that the pharmaceuticals waste generated in California were trucked thousands of miles across the country for disposal. Now, our new Chronolux incineration process, permitted here in LA County, combines two proven technologies, pyrolysis with a cold plasma exhaust system. This patented combination eliminates the harmful emissions associated with traditional incineration. We've been operating this environmentally friendly technology for over a year. Our exhaust is cleaner than a boiler, car, furnace, and incinerator. We have multiple federal and state permits in place, and we can currently take all end-user pharmaceuticals. In August, we expect to have our our DEA reverse distribution permit, which will allow us to take those also controlled substances, known controlled substances. This process has a very small amount of non-hazardous ash associated with it. MWS is proud to offer a local, affordable, environmental friendly, clean and safe green home for all of California's pharmaceutical and medical waste needs. Thank you.
Thank you. Next speaker.
Greetings in the spirit of the Most High. Shelia Ward. I would like to say that, first of all, let us not make plastics or plastic things or create something that is illegal in the future. That's our fault. We shouldn't even create these things to begin with. An ounce of prevention is worth a pound of cure. And second of all, don't drop off anything at a pharmacy because they might reuse it and give it to another patient that was in someone's home, and that's contamination. And 400 years ago, there were no diseases here. Why? Because we all ate properly, we exercised, and we didn't eat things that were ungodly. We ate fresh vegetables and fruit. We fasted 40 days, the beginning of spring, but for everybody. Fasted 40 days and didn't eat anything from anything that moved. We call it Fat Tuesday. You people call it Mardi Gras in the middle of winter instead of the first Tuesday of spring. The Almighty God made everything correct. Every herb-bearing seed in the which is a fruit-bearing. Almighty God said it's for meat. We, as humans, as gods and goddesses, as people, as man, we need to stop it. We shouldn't be sitting here talking about something at this late stage of the game. We're intelligent. We know that these needles, these drugs are harming everything and everyone in society, especially the animals, while they're being beached. Let us not do this. I don't want to live in a world where there's no crying and dying and no sorrow and no pain. That means we'll be Solomon's temple, nothing.
Donna Meredith, Allison Reagan, Lauren Akim, Eric Previn, Arnold Sachs, Brianna Clark.
Yes, it's Eric Previn from the 3rd District, and I support option 1 here. And I want to just make a moment on these pharmaceutical companies that are, they're to be loved and hated in equal measure because they are providing incredibly important medicines for the people in our community. But they have a profitable enterprise, and it's been profitable for many, many years. And this responsibility should fall on them, and I think this ordinance largely makes that the case. I think that quarterly drop-off dates is of note, but it should be monthly at least, because to do it on a quarterly basis is a weird detail. That's like the way supervisors think or government officials. Nobody thinks in quarters. We think in first of the month. So I think that would be a good area. And I can simply say that we have endured in our culture a lot from these pharmaceutical companies, some of which is positive, as I said. We have them all over the television dial now. They seem to have an enormous amount of money to run those commercials during every single event or kind of televised programming that skews anywhere above a teenager. You are inundated with this stuff. So I'm sure that working collectively, along with the other counties that have already worked out some of the problems with these programs and with this kind of an ordinance, the County of LA is going to be a leader in bringing something like this forward. And I want to just give a shout out to the many lobbyists who came down here on behalf of the pharmaceutical companies, and I assume we'll be speaking later on their point, which is that we can't do this because it's going to hurt the county and the business, because by taking $40 million out of this multi-billion-dollar industry a year in order to take care of our communities and the coast and all these things that are incredibly important, those businesses are going to be hurt. And we all remember that little prick, if I may use the colloquial expression, from Valiant or Turing, who laughed in the face of the congressional leaders when he was asked to, it was a slightly different issue, but it's the same group. Thank you.
Thank you. Ma'am?
Yes, good afternoon. My name is Brenna Clark, and I'm with the GPHA, the Generic Pharmaceutical Association. We're the trade association who represents generic drug manufacturers. We are also 88% of the prescription drugs dispensed in this country, but only 27% of the cost out there. We appreciate the opportunity to work with the staff and all the stakeholder processes. But we understand the concerns on this issue, which is why we have come together with the rest of the pharmaceutical industry and the sharps industry to provide a viable alternative, because the fact remains that the Alameda County program isn't working. There have been 0 kiosks placed in Alameda County under this program, 0. So that's not convenient, that's not easy, that's not a good alternative for anyone. But what is the fact the industry, we feel very strongly that an educational program can really change patient behavior, which is what we need to be successful in this area. So we hear your concerns, we want to work with you. We respectfully request you reject this ordinance in option number 1, and instead consider an education plan that can truly change patient behavior and address this problem successfully. Thank you.
Thank you. Finally.
Yes, thank you. Good afternoon, Arnold Sachs. And listening to part of this conversation, I really wasn't going to talk about this, but then somebody mentioned something about education and then the policy and the record of time that's passed, board resolution in 2008, and then the adoption of a roadmap in 2014. And I started thinking back in the back of the room, you know what this reminds me of? And one of the women speakers was absolutely right. She mentioned big pharmacy. Methamphetamines. Remember that? There was a big discussion how long it took the pharmacies to react to the methamphetamine. People were stealing the cold remedy tablets that had the active ingredients, and it took them years to actually agree to actually lock them up. Same situation. This is years and years and years doing the right thing while they're making money. Going. So the same thing happened in methamphetamine, because as a matter of fact, they had a discussion back in city council in the city of Los Angeles. And it brought it up. I said, you know, it took forever for somebody to finally decide to say, you need to lock these cold remedies up. You need to get them out of reach so that people can't walk into pharmacies and grab a whole crap load of them and then walk out the door. And it took them years. And it's the same thing. It's about the money. And it's about the money that lobbyists pay to keep you in office. And there's a problem there, too. Thank you.
Madam Chair.
Yes, Supervisor Untitled.
We say the committee has done a good job, public health in the county, and I appreciate all of the people who come down to testify, but I would like to move that the board of supervisors would direct the county EPR working group to work with the stakeholders to implement and immediately launch, in accordance with the recommendations in option 1 of the report presented in item R1, a public education outreach program approved by the Director of Public Health with those quarterly take-back event days. Direct with Walgreens to assess the performance of Walgreens 24-hour case oxygen, report back on established benchmarks and best practices that have been developed as a result of their take-back operation within their pharmacies. Report back with a status report in 60 days with a final report evaluating the implementation of the take-back education quarterly collection events. Report would include benchmarks that measure the effectiveness of these activities, and refer item 22 and 73 back to the Department of Public Health, directing the acting director to present those findings and recommendations resulting from the EPR working group's evaluation to the board. And this report should be provided at the board's November 1st, 2016 meeting.
I'll second that. Madam Chair, I do have a question. Is it to sort of clarify on the take back? Are these take back being funded by the industry through a grant for law enforcement? Through grants? Do we know that?
I think we need to have a public-private partnership in the program.
But I assume that then part of that is the take back that the recommendation is then to have it funded by the industry, right? Correct?
We'll have the department respond.
Here we have The experts from public health. Angela, can you answer that question?
So I think the preferred approach would be to have the industry fund those collection events, and we can certainly reach out to the industry to see if we can make that happen.
Supervisor Kuehl?
Thank you, Madam Chair. It could be the time of day, but I'm going to say something a little grumpy. It looks pretty clear to me that the ordinance will not be adopted today. The motion is to put it off essentially to November if it ever happens. And I think what has happened along the way is that, as often happens, the staff is very good and does everything that it's asked to do and recommends those things that make a good deal of sense. And then things get very clouded. And in this case, I think got very clouded over the past several months in terms of whether there would be a long run-up on thinking about what the ordinance should say, how much participation the industry should have, what we might do in the short term. And the grumpy thing I want to say is that I think it makes about as much sense having the pharmaceutical industry be in charge of their take-back as it was for Southern California Gas to be in charge of looking at their leaks. It's not the right way to go. To be less grumpy, I will abstain on this motion today because what I do like about it is that we'll get a report in November, which looks like the first time we're going to get anything serious done about it anyway. I want to say that I'm very serious about getting something done on it, and I've always been very patient about getting things through. We couldn't even protect gay students for 6 years up in Sacramento, and all we kept saying was, we're back. And what I want to say about this ordinance is, I think I can say, I don't know exactly when, but we're going to say we're back, because it'll be good to have the data from 5 or 6 different Walgreens, drugstores taking things back every quarter, because in my opinion, it will show how weak it is, how ineffective it is, and how much more we need. So I'll be very happy to have that kind of information. I am disappointed, though, as I said, it's not unusual for us to kind of go back and forth, especially with an industry, with a number of people who think differently about how things should be done. This is complicated. There's no question about it. But as a former member of the Waste Board, I have to say that I was always in favor of the pharmaceutical industry being required, and other manufacturers required, to pay for whatever recycling goes on, with the cooperation of the county, like having drop-off places in our fire stations. Everybody then knows where their fire station is, which is a good thing too. But before we ever had curbside recycling, there was a lot of talk about how little we could do about recycling in general. And we've come a long way because we keep working at it. I want to say that for me, I don't see us having an ordinance today. I see us having a little bit of a take-back experiment. Fine. I look forward to the report back, and I look forward to a very strong ordinance, even if it has to be in 2017.
I just want to say that when this came to me originally, I was very enthusiastic about the possibility of the county leading, in part, the southern part of California, because Alameda already did it. And I thought, this is the way to go. We're so innovative. We have good data. We have good people. And the research and the report that was put together says it right here. The ordinance provides the board the opportunity to provide safe, convenient, sustainable options, protects the environment, protects the public's health, and helps to save lives. But it's not happening today. And that's what I'm disappointed about. And I know my staff and our county staff, you all have worked on option 1. And that's a good compromise, but it's only 5 cents for me. We still need 95 cents, and we don't have it. So I too feel at this time that it's better that I remove myself and abstain at this time. So let's, are there any other comments? We have two. We're going to call the roll.
Supervisor Ridley Thomas. Aye. Supervisor Kuehl. Abstain. Supervisor Kanabi. Aye. Supervisor Antonovich.
Aye.
Supervisor Solis.
Abstain.
The motion carries.
Okay, the motion carries. 2 abstentions.